So I'm making this video for rural healthcare providers that are small and just can't catch a break. Maybe you are a fire department that needs to hire more EMTs. Maybe you're a small single site mental health clinic that wants to start providing telehealth services. Or maybe you're just working as a physician in a hospital and you want to start your own thing. You want to start your own clinic or start your own external service that is something new. Well, the Rural Health Transformation Program is coming out. Funds are being distributed thick and fast, $50 billion across 5 years. And this is your chance potentially to turn a corner and do something new. I know for small providers, staffing is extremely hard. You might not have another physician for 20, 30 miles that you could even call up and ask them to come work with you. And nurses, dentists, even care workers, CNAs, every position really in healthcare is hard to hire for. The Rural Health Transformation Program could help solve that. There's recruitment and retention grant opportunities. If you're trying to make things more digital, there's a big push for tech innovation and tech enhancements, telehealth provision, EHR integration, or even if you just want to improve the health of your local community, there are funds there to make America healthy again through promoting nutrition, promoting exercise, and healthy lifestyles. In this video, I'm going to tell you a little bit more about the program and opportunities that exist for small rural healthcare providers that maybe aren't included in the big headline groups such as critical access hospitals or federally qualified health centers. So the first thing you need to realize about the Rural Health Transformation Program is whilst there's $50 billion coming from CMS into the states, it's actually the states that are administering it. So if you're in Delaware, you need to go on to the Delaware Health and Human Services website and read about Delaware's application, Delaware's program, and what Delaware is doing for the Rural Health Transformation Program. Things are state-based, and you're not going to be going directly from the federal level to acquire these funds. And that's good news for some of you, and it's bad news for others, I'm sorry to share. So some states are going to really kind of lock into existing systems, existing healthcare conglomerates. Maybe they've got 10 hospitals, 20 rural health clinics, and really go in from the top down. That's going to be not great news for you because you ideally you want to get a response to an RFP and get grant funds directly into your organization. But there's others that are going to be more from the ground up. So making sure things are spread quite equally across geographies, across organization types, and offering a lot of micro grants, you could say, for providers. For example, Iowa have released their best and brightest recruitment and retention grants, so they have 150 available for rural healthcare providers, $18 million to be spent. I think the closing date is in the next couple of days. And those funds are something that if you were in Iowa, you could have put your hand in to the pot and hopefully try and pull out a bit of funds. Now, if it is in your state a top-down approach, do not worry. Okay, so regional partnerships do exist. When you go for this, it's not a case then maybe of directly applying for a grant for your small organization, but approaching whoever is in your county in terms of that local hospital, long-term care facility, home care agency maybe, or regional health partnership and saying, here's who we are, here's the grant program, maybe they haven't heard of it, and we'd love to be a part of something together with you. You're coming in as what I would call a sub-grantee that gets a sub-award from the grant award, which is going to the bigger overall regional organizer. So have a look at what your states did, see who they ideally want to fund, and if they're going for a more top-down or bottom-up approach, and then get to work. So if it's more bottom-up, there's going to be grant awards available for you. Start preparing your pre-application. So think about what programs you could fund, get a timeline sorted, contact, again, local providers who you can network with. And if it's top-down, well, the answer is simple. You need to reach out to bigger providers in your area and say, what are you doing to prepare for this, and how can we be a part of it to together lift the tide, lift all those boats together in your area. So do a bit of preparation for this, figure out what your state's doing, and you can make a difference. for your small organization. So what do you actually say to those bigger connectors, bigger providers in your area, or indeed to the state whenever you make your application as a smaller provider? Well, you need to be crystal clear on what you do, why you need funds, and then how funds are going to make a difference to your organization and ultimately the health of the community that you serve. It's quite simple. And that's the way I think small organizations have the advantage. Okay, if you're a bigger provider and you're covering a large geography, of course you're issuing for these funds and of course you can make an impact. But whenever you're a small organization, you can really go into a community, be a pillar of that community, and really lift the healthcare of that community up just through 1 to 10 staff members. Let's take my example of the fire department with their EMT. Local fire departments prevent the town burning down. Huge, huge need. And EMTs and emergency medical services is a big part of the rural health transformation program. Whenever you come into stating what you do, don't just make it about your role in the healthcare, but in the healthcare provision, but ultimately in the maintenance of the society of your area. I talk about how many people rely on you. Talk about some of the case studies of differences that you've made whenever you've gone out on a shout or you've gone out and saved lives, and what your EMTs do and what would happen if you were just an EMTs left and you couldn't replace them, or what would happen ideally if you could bring more into your area through training or relocation programs. You need to paint the picture. You need to show what you, as a small provider, provide in terms of the foundations and the structure and prosperity of your area. And don't miss this opportunity. As I said earlier, this is generational. This is not going to come around again. These funds were inserted as part of the One Big Beautiful Bill / HR1 program. They were inserted due to cuts in healthcare, cuts in Medicare and Medicaid, which would particularly hit rural areas. They were inserted in some way to help rural healthcare providers, but in other ways to maintain the votes of the rural base of the Republican Party. That means that when the next government comes in, it's going to be really difficult for them to replicate this program and justify that to voters in Congress because it's already been voted in the previous one. And I don't foresee a similar program coming up in the next couple of decades. So now's your chance to win some money, which is hard to find, particularly in rural health, for your small organization. If you want a bit of support, you can reach out to me. I'm Adam, the founder of the Rural Health Workforce Transformation Hub. We are working with healthcare providers, particularly smaller organizations across the country, in their Rural Health Transformation Program grant applications, program design, and implementation. You can, somewhere around this video, click a call link to book a conversation with myself or one of my colleagues. And we can talk through it. We can brainstorm with you, learn what your organization does, talk about your state's application of the program, and see if there's a way where you could access these funds. We can help you do that for free. We don't charge anything until we start working for you whenever you win the funds. All the money comes from the grant program. So, hope you find this useful. Hope you get in touch. And until the next video, I hope you keep having a great day and providing healthcare to your community. Thank you.